Mema obi biara akwaba eba Vybrant Health Talk Show so. Eno dofo nti na me ha na me pese me ne okasa fa wapomuden ho efiri se wapomuden wo hoi ehia me yie pa. Me pese ye kasa fa wapomuden ho. Today we are going to tackle the aspects of the eye. We are going to talk about most of the conditions related to the eye. Taking the anatomy of the eye, we have so many parts of the eye. Let's take a brief anatomy of the eye. When you take the eye, we have the sclera. The sclera forms the white portion of the eyeball. Also, we have the pupil. When you look at the center of the eye, we have a dark spot over there. That is the pupil. The pupil also control how much light enters the eye, and also we have the iris. The iris forms the color part of the eye, and the iris also surrounds the pupil. The iris also control how much light enters the eye and also changes the size of the pupil. We have the retina. The retina forms the most sensitive portion of the eye. The retina also contains cells that help us to sense light. It also contains cells or blood vessels that nourishes the eye. The retina has two parts. It has the sensory portion, that is the photoreceptors, and a layer of pigmented epithelium. We have three main layers of the eye. We have the outer opaque sclera, and also we have the middle vascular layer. Then the last one is the innermost layer of the eye called the retina. We have two main chambers of the eye. We have the anterior compartments. We have the posterior compartments. The anterior compartment contains a fluid known as the aqueous humor, which contains a trabecular meshwork through which fluid is drained between the junction of the iris and the cornea. The posterior compartment is the largest and is being formed, or it produces a fluid called the vitreous humor. Other parts of the eyes are the iris, we have the lens, we have the conjunctiva, we have the cornea, and the others. Now, let's talk about the abnormalities of the eye. We have so many abnormalities of the eye or conditions relating to the eye. We have the conjunctivitis, we have the iritis, we have the glaucoma, we have the trachoma, we have the style, we have the chalazion, and many more. But today, specifically, we are going to talk about glaucoma. What is glaucoma? Follow me. Let's know, or let's learn something about glaucoma in order to treat our older people and even those with glaucoma in our homes. Glaucoma is a group of diseases that affect the optic nerve of the eye, or glaucoma. It's a medical term used to describe when there is a damage to the optic nerves of the eye. As we already learned in school, someone may ask, what are nerves? Nerves sends electrical impulses to the body, such as the eye and the brain. The optic nerves of the eye help the eye or help us to perceive brightness. Also, it helps us to perceive color. All these things are possible because of the optic nerves. What causes damage to the optic nerves? Or someone may ask, what can cause a damage to the optic nerves of the eye? Naturally, we have something called the aqueous humor, or something called aqueous fluid. This fluid is being produced by the eye. Naturally, the size of this fluid should range from 10 to 21 millimeters per mercury. This fluid shouldn't be so high, or this fluid produced by the eye should be at its normal size. Normally, glaucoma occurs when there is high level or the fluid of the eye rises, or when there is high intraocular pressure. This pressure then causes damage to the optic nerves. This fluid produced by the eye has so many functions. It nourishes the eye, it protects the eye, it provides nutrients to the eye, as well as It maintains the eye at its pressurized state. This fluid also baths and nourishes the lens and maintains a pressure within the eye. Normally, as this fluid being produced, the fluid has to drain out of the eye through something we call the trabecular meshwork. Normally, this fluid or this aqueous fluid or intraocular fluid produced by the eye has to drain through something we call the trabecular meshwork in order to maintain the normal size of the pressure of the eye. Failure of this trabecular meshwork to drain this intraocular fluid causes high level of the fluid, leading to damage of the optic nerves. The nerves are very vital for vision. As the optic nerves becomes damaged, you begin to lose or lose your vision. We have types of glaucoma. We have open angle glaucoma, which is the most common cause of glaucoma. We have the close angle glaucoma. We have the normal tension glaucoma. Then we have the pigmentary glaucoma and even glaucoma in children. What are the signs and symptoms of glaucoma, or what are the nearby signs in order to identify someone is having glaucoma? 1. Having internal ocular pressure. 2. Being black. Also 3. Being over age of 60 years. 4. Having certain medical conditions such as diabetes mellitus, heart diseases, high blood pressure, and sickle cell anemia. Also 4. Having corneas that are very thin in the center. 5. Being extremely nearsightedness or farsightedness, such as the presbyopia and the myopia. Also having certain surgeries of the eye, and also having injury of the eye, you are at risk of getting glaucoma. And moreover, taking corticosteroid medications such as the eye drops. How can we prevent glaucoma? 1. Get regular dilated eye examination. 2. Know your family health lifestyle, and also exercise safely or exercise regularly. Also take prescribed eye drops regularly, or take eye drops being prescribed by the physicians only. Also wear eye protection in everywhere you go, or protect your eyes when working, such as the steam benders and the weathers and those kind of jobs. You have to protect your eye very well in order not to cause any injury. Thank you for watching me, but don't forget to subscribe to my YouTube channel, like, share and comment on every video that I post over there. Vybrant Health Talk Show, your healthcare, it's always my priority. Don't forget to send me your question. Ask me any question about glaucoma. If you know PBB glaucoma, but one thing, for question ebra na me one no pepepe. Nyamin shroud so share me. I feel so me obia happy Father's Day. Nyamin shroud yipa.